Good morning, all. Myself, Navestri. I'm from Jigularity College of Pharmacy. Today, I'm giving the presentation formulation and in vitro evaluation of propylene bisulfate nanosuspension using box banker design. Coming to the introduction part, this propyl bisulfate is a thionylpyridine with antiplatelet activity to inhibit the blood clots in coronary artery disease and peripheral vascular disease, and it belongs to a BCS class 2 drug. It has poor aqueous solubility and high permeability. Due to its pure aqueous solubility, it is reported bioavailability following oral administration is less than 50%. To overcome this problem, we are formulating using nanotechnology. These nanosuspensions can be used to improve the solubility of the drugs that are poorly soluble in aqueous media as well as lipid media. As a result, the overall viability is improved by an increase in the surface area and saturation solubility via particle size reduction. Nanosuspensions are shown to a greater drug loading compared to the other oral dosage forms. Thus, lower doses required to achieve the intended therapeutic effect, and the patient compliance can be improved with the use of this drug delivery system. Box banker designs are experimental design for surface response methodology, and here we are considering the three factors and three levers selected for optimization to expose the quadratic response surface using the design expert. And each factor or independent variable is placed at the 1, 3 equally spaced values, so coded as -1, 0, and +1. And design should be sufficient to fit the quadratic model, that is one containing the squared terms, products of two factors, linear terms, and an intercept. Coming to the aim of an objective of this study is to enhance the upper solubility of propyl bisulfate following its bioavailability, and it is used to formulate the nanosuspension of propyl bisulfate by nanoprecipitation method, and it is used to evaluate and optimize the propyl bisulfate nanosuspension using box banker. And coming to the materials, this propyl bisulfate nanosuspension were prepared by using the polymers which were selected based on the precipitation method, and PVA is polymer is selected for formulation and evaluation of propyl bisulfate nanosuspension using box banker design. And this is the table which shows the uh, uh, this is the table which shows the polymer with how we have selected, and no precipitation it was shown as negative, and with the low precipitation it was plus, and with high precipitation it was plus. And coming to preparation of propyl bisulfate nanosuspension by nano precipitation method, the 75 mg of propyl bisulfate was dissolved in ethanol with continuous stirring, and the aqueous phase was prepared by dissolving the polymer in water, 20 ml of water with continuous stirring using a magnetic stirrer with a constant speed of 300 rpm. And the organic phase was added to the aqueous phase dropwise with the help of stirrer and stirred under the constant speed of 300 rpm. The sudden addition of organic phase into the aqueous phase was the precipitation and leads to the formation of nanosuspension. And coming to the results and discussion, it was here FTR studies are given. These two images are showing there is no possible chemical interaction between the drug and experience in optimized formulation and as well as pure drug. And coming to formulation of propyl bisulfate nanosuspension by using box membrane design. Here it's showing the 13 runs, and 13 formulation, 13 is nothing but 13 formulation, and these are analysis of responses. And coming to this is a three-dimensional plot of drug release plotted between the drug is to polymer and temperature, and that is the 3D plot of drug release plotted between the solvent and anti-solvent and temperature. Here in this image we observe that blue color was minimum drug release. As the drug release increases gradually, the color shifts from blue to red. And here the ratio of solvent and anti-solvent increases, and the dissolution is also increases, which is indicated by the red color, and the dissolution decreases as the temperature increases, which was indicated by the blue color. And coming to the numerical optimization, here out of 65 one solution we are considering. And coming to the overlay plot, the acceptable criteria is in bright yellow color, and unacceptable criteria is in gray color. Here predictor factor, concentration as well as numerical solution. And coming to the in vitro dissolution studies of formulations of all the runs, here it was showing. And coming to the evaluation test. Here, evaluation was for viscosity, dispersibility, drug content, and entrapment efficiency. And the drug entrapment and viscosity and percentage drug release were found to be 78%, and drug content for a final formulation was observed 99%. And coming to this is the optimized formulation, and coming to the model dependent kinetics. Uh, Here the data in vitro release profile was optimized and a suspension showed best fit into Hazuki model and Postman proposed model. And this was a surface morphology of nano suspension uh, by same electron. By scanning electron microscope, it was showing three-dimensional images of globules, which was magnified 2 micrometer, 5 micrometer, and 10 micrometer. This was the in vitro diffusion studies of optimized formulation. Coming to the conclusion, optimized global bisulfate nanosuspension were carried out using box and design with the temperature, drug to formula, anti-solvent, and solvent ratio as independent factors, and percentage drug release as a dependent factor. The 13 formulation in the runs, each formulation effect of percentage drug release was studied by conducting the in vitro drug release studies by using GSP type 2 and with the resolution 0.1 normal HCl as a media at 50 rpm and for 19 minutes. And here it was found that formulation 9 and formula F9 and F13 showed the best drug release with 82% compared with all the formulation, and the entrapment was found to be a 78% of drug release, and it was found to be 84. And based on responses obtained, the overall plot optimized formulation was found to be a one with temperature of 30 degrees, drug is to polymer ratio 1 is to 4, and the solvent and antifungal is 1 is to 30, which was then formulated and evaluated for surface morphology, particle size, quality dispersibility index, zeta potential, viscosity, entrapment efficiency, drug content, and in vitro drug release. These are the references, and thank you.
అయిపోయిందా